That's the best way to kind of get that top layer of connective tissue off. So you can grab it with the forceps. That usually tends to get the best grip. It's easier than grabbing it with your fingers. And then pull that connective tissue off by kind of cutting right next to the surface of it. Now underneath, what we're looking for is muscles, right? So underneath, you're going to hopefully see some muscles and their specific fascicles or bundles of cells. And what I'm doing now, occasionally I nick a muscle, and you can usually tell there's a distinct difference with the way those tissues look. So that dark pink, that's where I nicked one. That's okay if you nick it. That's totally fine. That just means you hit muscle. You won't have any more connective tissue to worry about. Okay? Same thing there. See that dark pink? That's muscle. Okay, so that's okay. We're just sort of trying to remove this more superficial layer of connective tissue. Now where you have to be a little bit careful is on the medial side, okay, of his legs, because this area with the fur, that's his anus and his genitals, or hers in this case. So there's anal glands there that you don't want to puncture, so just kind of leave that furred area alone and go between the leg and the furred area. You can get that connective tissue out, okay? So you're going to kind of do that all over his hip and his leg. There's no need to go way up here. There's no need to go way over here on the sides because we're not looking at muscles over there. Once you've kind of gotten into it a little bit, and you'll have to do this on the medial side too, but once you start to see muscles, we can start doing some isolating. And so the best way to do isolating is just use your probe and kind of poke around in there and feel for a natural separation. So see how easily my probe went between these two muscles? That means that's a natural division there. If it doesn't, it's not going through there. That's because that's all one muscle. So once I feel that natural separation, I'm just going to kind of use the probe to separate that connective tissue. Okay. So this is usually the part that takes the longest, this and getting the connective tissue off. And so this is a nice place to start between this muscle here, the biceps femoris, and then over here on the lateral side, I've got a couple muscles. I've got my sartorius, and I'm pinching, and I can go up under it and isolate that. So this is going to be the sartorius, so you can see how clean that comes away. And then over here we've got our vastus lateralis, and then up here a little ways, and this is that tensor fasciolata that I mentioned in lecture. That one's just a little piece of muscle. So that's the majority of, the technique for isolating and identifying. If we fast forward, so we'll do your prosected one.